Dr. Richard Berger of Rush University Medical Center in Chicago is the pioneer of minimally invasive hip and knee replacement procedures that involve cutting less tissue and allow patients a much quicker recovery. Paddleboard racer Jen Hulett was able to get double knee replacement from Dr. Berger and take advantage of a new virtual consultation program called the B.E.S.T. Since patients don't have to fly to Chicago for surgery, it's a time saver and cost saver for patients. And here to tell us more is Dr. Berger himself and his Fort Lauderdale patient, Jen Hulett. Both of you, welcome to Inside South Florida.
Thank you.
Thanks for having us.
Dr. Berger, let's begin with you. Minimally invasive hip and knee replacement surgeries, they exist. You have an engineering degree from MIT that has helped you pioneer a procedure that cuts less tissue and results in faster recovery for patients. Tell us why so many patients fly in from all over the world for your procedure.
Well, just for that reason, without cutting the muscles, ligaments, and tendons, just everything is faster. You get a faster recovery, less pain, less therapy, quicker back to your life. In addition, without cutting the muscles, ligaments, and tendons, the hip and knee just simply recovers better, more fully, back to where you want it to be, back to where you expect it to be, back where it was 20 years ago before you got arthritis.
Jen, you have been a paddleboard racer for years. I just discovered paddleboarding, here for all of it. When did you know, Jen, it was time for you to have surgery?
Well, they always say you know when it's time, and I think that's kind of true. I've always been very competitive, and so I found stand-up paddleboard racing and surfing. My best kind of event was Carolina Cup, where I was #1 podium for my age group. But the irony of that was I could not run across the finish line. I kind of shuffle stepped and could barely jump off my board. So between that situation and then from then on, it was just increased pain, decreased activity, a lot of ice and Advil. I really knew it was time, and lucky for me, I found Dr. Berger, read about his minimally invasive procedure, tons of testimonials by very active people who were able to get back to do what they love. And here I am, 7 months post-surgery. My life is changed.
Well, the good news is, Dr. Berger, patients don't have to go to Chicago initially to take advantage of your expertise. You now have the B.E.S.T program, Berger Elective Surgery and Telemedicine experience. Tell us more about that.
We call it the best experience because that's what it is. It's the best experience. We marry telemedicine with what we do hip and knee replacement. So you can come to see us in person if you'd like, or you can do it over the computer from the privacy and comfort of your own home, where we'll see you, we'll examine you virtually, we'll look at all your x-rays, figure out if surgery is the right thing for you. And if it is, you schedule an appointment to come see us. Yes, you have to come to Chicago to get the surgery, but you stay 2 days in Chicago, fly back to wherever you are, and do the rest of the recovery at home. Then we'll do the follow-up visits virtually as well, if that's what you want. So we're trying to make it easy for people to recover.
Jen, Dr. Berger, thank you so much.
Thank you so much.
Thanks for having us.